Le micro aussi. Donc, là, vous me voyez bien, non? C'est pas comme ça, non? Ok. Je vois.
Bonjour, bonjour, bonjour à tous et à tous.
Good afternoon.
Je suis
Good morning, everybody.
un instant, je vais recommencer, excusez-moi. Je vais mettre la caméra.
Let me turn my camera on.
Et voilà. Bonjour, bonjour à toutes.
Good morning, good afternoon, good evening, everybody. My name is Beatrice Nayambayo, Program Manager at Pathfinder in Sexual and Reproductive Health for teenagers and youth, financed by the Packard Foundation. And it's with great emotion that I'm taking the floor today to tell you the story about the DSSR project, a project that really had a big impact on my personal life, and I also believe changed the fate of thousands and thousands of youth in Kinshasa. It's a project that was born out of a client project. In 2015, we launched this project with a strong ambition to guarantee teenagers an equitable access and universal access to sexual and reproductive rights services. Back then, the people had to face a tough reality, lack of resources, lack of needs, and a great stigmatization around sexual health, and strong opinions on gender and abortion. I remember the visit during with a young girl in Geringeri, where a young girl told me, I can talk without being afraid. It was a strong and powerful sentence, which sums up the essence of our mission. Next slide, please.
Je m'excuse.
Sorry.
Je m'excuse infiniment.
Apologies for this delay.
Désolée. J'avais déjà commencé ma présentation, je me suis trompée. Je m'excuse.
Sorry about
Donc, je
that.
recommence. Voilà, bonjour à tous et à toutes.
So I'll start again. So thank you, congratulations, and welcome to this webinar, which is focusing on legacy of the DSSR Adolescent Youth, which is a strong initiative with the foundation, with the support of the Packard Foundation. We are going to live together 90 minutes of sharing with very strong narratives. And to open the session, it is my pleasure to give the floor to Dr. Marie-Claude Kaboulé-Ba, Country Director in DRC for Pathfinder, who is going to present the goals of this project and the webinar. And apologies for this technical issue and the anticipation. Dr. Marie-Claude, you have the floor. You have 5 minutes.
Merci, Beatrice.
Thank you so much, Beatrice. Good morning, all. And it's with great pleasure that I welcome you to this webinar, which is going to focus on legacy, on the legacy of the DSSR project in Kinshasa, which was implemented by Pathfinder during 10 years. with the financial support of the Packard Foundation. So this webinar shows the end of the project, which focused over 2 years, since 2015 until, so 10 years, not 2 years, 15, 25. The goal of this project was to guarantee to youth and teenagers in Kinshasa, mostly, and also intervention areas, an equitable and universal access to healthcare and sexual and reproductive rights services with great quality, without any discrimination, without any stigma. And today, we are going to go back and revisit this trajectory and also the different milestones of this project, and go over innovations, results, but also challenges, while focusing on different perspectives so that we make the learnings sustainable. Thank you so much. Now we are going to give floor to the different participants. They are going to show the different steps, the different milestones of this project. Thank you so much, Béatrice, and you have the floor back.
Merci, Dr. Marie-Claude.
Merci. Thank you so much, Dr. Marie-Claude.
Alors, je vous invite maintenant
Now I invite you to travel through years of impact, where I had the privilege and the pride of supporting. My presentation will show the different milestones of the DSSR project, the results, innovations, and the lesson learned, and that we will try to make sustainable for the years to come. So I had gone a little too far earlier. So I remember that visit in a health center where one young lady told us, "Here I can talk without being scared." And that very simple sentence is the essence. This is quintessential to our mission. Next slide, please.
Voilà. Le projet est un projet. Je vais attendre la diapositive, s'il vous plaît.
Next slide, please. I don't see the slide.
Nous avons ce projet qui est un projet
this project shows some progress, as you can see. You can see that the ultimate goal was to guarantee an equitable and universal access to sexual and reproductive health services, including post-abortion services for the 15-24-year-old. Our beneficiaries were the youth that lived in 3 areas, and that was supported by the Packard Foundation since 2015. So Massina 1, Matete, and Geri. It was a multi-phase project and 6 phases. You see the different steps on the screen. And I'm going to go over each phase. So come with me on that trip as if we were walking, so that we can go over each phase of the project. Next slide, please. So first phase, we started in January 2015 until 2016, was the creation of a youth corner in 6 health facilities in 3 areas. in Kinshasa.
Ces espaces ont été conçus pour offrir un accueil
So the
chaleureux,
idea was to
confidentiel et
welcome
adapté aux
warmly this youth,
Il ne
and
s'agissait
so
pas
we would be
seulement de
adapted to
murs et
them.
d'échelles,
It was
mais
not
d'un
about the
changement
walls
de
and the
culture.
furniture, but a change of
Former
culture.
le prestataire,
Training
sensibiliser et former
the
le personnel
providers,
médical,
the
équiper les
non-medical
centres en
staff,
matériel
and
adapté et
provide the
surtout
right
écouter les jeunes.
the right
Diapositive,
tools
s'il vous plaît.
to those centers and listen to the youth. Next
Nous
slide.
avons lancé
We
dans la
launched
phase 2 qui commence
in
janvier
the second
2017 et
phase
décembre 2018.
in January. We started in January
Nous avons lancé
2017. We launched
de
a
réduction des méfaits
pilot
liés aux
project
avortements à risque.
and to provide
Une histoire
information
marocaine,
about
celle d'une jeune fille
misconceptions.
qui s'est forcée de se
So,
marier
for
à
example, there was
régler
one young
la
lady who
familiale.
was forced
Elle est tombée enceinte et
to
a dû
marry
payer
her
une suite.
uncle to settle a debt.
Eh bien,
She
grâce à ce
got
projet,
pregnant,
elle a pu
and thanks
recevoir
to the
des soins
pregnant,
sécurisés,
she was
reprendre
able
ses
to receive
activités,
some.
retrouver sa
She was
dignité.
able to receive
Ce pilote a
some.
permis
She
à
was to have an
70% des
abortion,
jeunes femmes
get back together
de
on
vivre
her
leur
feet,
grossesse en
and
toute sécurité.
go back to school.
98% ont adopté une méthode contraceptive
And
moderne par la suite.
after those visits, they were able to adopt a new method of contraception. And 90% were able to use contraception after this visit. Next slide.
Allons dans la troisième
Now, let's move to the third phase.
à décembre
In January 2018
intégré
until
les
20,
jeunes vulnérables
we integrated the vulnerable population within this project, especially the mute and hard of hearing, those who live in a situation of disability, the youth, the homeless.
et impliqués dans le
We heard them, listened to them, and they were involved into the work of the community. We train providers in sexual and reproductive health, adapted to their problems, to their concerns, so that their voice could be heard.
Diapositive, s'il vous plaît.
Next slide.
Nous cheminons vers la phase
Now
4.
we're moving to
janvier
phase
2021
4,
à décembre
January
2022.
21 until 2022. It was an evaluation with, thanks to this
Les
program.
résultats ont confirmé leur efficacité.
The results showed how effective our program was. The youth love our space because they're accessible, because we listen to them, and because of the quality and the care that they can have access to. They used to say, before I knew nothing about sexuality, and now I am informed, I protect myself, and I talk about it to all my friends. Next slide. We're moving to phase 5, January 22 until October 24. We strengthen our services with through better training of our providers.
Donc, santé sexuelle et reproductive des adolescents et jeunes. La formation de 20 prestataires en langue des signes.
So we train 20 providers with sign languages to facilitate communication and guarantee confidentiality of the mute and hard of hearing youth. We provided vouchers for free services, and we also focused on mentoring with peers. One of the providers told us, said, before, I didn't know how to use it. I didn't know how to help a deaf and hard of hearing person, and now I can understand them and provide some health services. Next slide, please. So last phase, which is the 6th one, November 24 until 25. And during this phase, we basically facilitated the transfer of this initiative to the government. the local structures became member of coordinating platforms of sexual and reproductive health services. This transfer is a key step to guarantee the viability and the sustainability of what we have done. Next slide. So as a result, the results speak for themselves. Over 111,000 young people that were informed thanks to information on sexual and reproductive health information. Over 181,273 youth that benefited from those services. That's the total of the visits in the youth corner, the different health centers about HIV, post-abortion care, STDs, and family planning. We provided thousands of contraception methods. During phase 1 and 2, we also offered care to gender-based violence survivors, 648 of them. And during phase 4 and 5, 92 girls received global abortion care. We also train 40 providers by phase to reach a total of 200, 375 peer educators. So I'm not counting the 6th phase, which was basically the stepping down phase. So we're not only talking about statistics here. Those numbers represent lives, protected youth, and strengthened families. Next slide. When it comes to innovations, they really showed a difference in our project. They include
Le projet s'est distingué par l'introduction de plusieurs innovations majeures qui ont véritablement
many innovations that really transferred our approach to sexual and reproductive health. The integration of sign language shows a significant progress towards more inclusion, more inclusivity, which enables disabled youth to have access to information and care. The mentoring of young champions reinforce and strengthen their leadership and the ability to bring advocacy within their community, which creates a dynamic and sustainable dynamic. The availability of the free vouchers enabled free access and safe access and better equity of services, and finally, the creation of a consulting council of youth guarantee that their voice is being heard and that we take them into account. These decisions were used by our partners in many other initiatives.
Le plaidoyer a été au cœur de notre action. Grâce à nos partenaires, le protocole de Maputo a été publié dans le journal officiel autorisant l'avortement dans les cas de
Advocacy
viol,
was really at the
d'inceste,
core
de
of our
danger
action.
pour la santé de la
And
mère.
thanks to
Nous avons
our
aussi
partners'
contribué à la
work,
validation
we managed
des
to
premières
publish
normes cliniques
in the
nationales pour le
official
suivi complet
journal
d'avortement en RDC.
the
Ce travail de
vote
fond
for the
est né
measure
avec la
for
coalition,
complete and
avec des
comprehensive
coalitions comme
services for
la
post-abortion
CGND,
care.
la
And thanks to this
coalition des
partnership,
grossesses non désirées, CAFCO et
we
l'Isabelle
could
a
work with
permis de faire
non-desired
évoluer
pregnancies. And we built a coalition, which of course was a way to set up a legal frame for youth, for the youth and for the rights of those young people. We also had lots of testimonies, including one that says, "Now I am well informed. I'm coming here with my girlfriend and I have double protection." He was a young participant, and it makes our heart beat when we hear this kind of testimonies, because it reminds us why we're doing all this work. We cannot talk, we cannot work without our partners, we cannot do anything without our partners, and we really want to express our deep gratitude for our institutional and community partners, for technical and funding partners, for the effective collaboration that is very precious, and their constant support, their engagement, their commitment, and this really effective collaboration that changes everything and helps us bring health services, sexual and reproductive health services of quality care, quality services. That is, I also want to insist on the fact that, of course, the Ministry of Health is indeed a very good partner in this project as well. And we are working really well on the National Program for Health. The category of the local organization, that's our partner in Kinshasa as well. And the foundation in Texas is really important for our work in the International Youth Alliance as well, for family planning in several villages where we conduct our activities. Regarding the category of international organizations, of course, NGOs, the foundation of Lisa Packard is MSI, UNFPA, Dumont, and this regarding the coordination group in the category of these groups for non-desired pregnancies. We work really in close collaboration with the coalition and the work group on health and well-being for adolescents and teenagers and young people. Thank you very much. Next slide, please. Our perspectives here and our call for action, while we are going to the next phase of this project, we have to think forward. And we have to think about the young people who need to be heard. Local organizations must be supported and strengthened. The advocacy must keep going for the rights of young people to be respected everywhere. This project is based on inclusion. We have to hear, we should not just hear them, we should listen to them. They are actors, not just beneficiaries. Next slide, please. I will say to conclude that it's really important for me to thank all the partners, young people, providers, institutions, and of course, pathfinders, the entire team. This project is a legacy, a collective legacy that was enabled because we worked together. Let's continue building a society where young people can access to sexual and reproductive health services with no discrimination and dignity. Thank you very much for listening. Okay, so I am back to moderating this session now. There you go. So now we're going to talk about the implementation on the field. Now we're going to talk about the strategic vision. No, I'm sorry. We're going to talk to go from strategic vision to reality on the field with Albertine, all right? We're going to talk about sexual abuse And on the field, she's the expert. She's going to talk about the community activities, about inclusion of young people who were marginalized. Albertine, I give you the floor. Thank you very much. Thank you very much for giving me the floor. I am very grateful to be here, and I would like to say hello to everyone again, to everyone who's listening to me. My name is Albertine Lavigne, and I am a technical advisor. I started to work with Madame Béatrice, and today I'm going to talk about the implementation of activities within this project and the challenges that we faced, and also the successes that we achieved. Next slide, please. So, as an introduction, I would like to say that the implementation of this project that we are introducing, that we're talking about today, was divided in three steps. So there was the clinical component to start with, and then the component that we called community mobilization, that consisted in creating demand and to give incentive to the young people to participate in activities that we were creating. And also we had the component called advocacy that allowed us to pave the way for a favorable environment so that the beneficiaries could access to those services that Madame Beatrice talked about. And it was not easy indeed, because many thought that they didn't have the right, they were stigmatized, and they thought they didn't have the right to access to those services. And that was really a light in their path to give them this access for those young people who really needed healthcare. Yeah. Next slide, please. So, in this implementation, I'm going to talk about the strategies that we have used so as to reach these results that Madame Beatrice has presented earlier. We used several strategies, but the main strategies that we used, the most important ones, are here. So that was the strengthening of clinical providers' capacities. And in this project, there was something new that we trained the staff that was not medical staff, because what we mean by that were, for example, the staff that is in the entrance of the medical centers. And that was very important. That was part of the strategy that we realized was very important, because they are the first contact of people entering the clinic or health center. And then we made sure that all the medicines were procured for contraception and equipment, also for the sexual and reproductive healthcare, so that the young people could be taken care of properly and with quality care. Then the offer of clinical services in the health centers, as Madame Beatrice said earlier, it was very important to work with partners, these organizations that really worked with us, those organizations that had activities with the young people already. They really supported this project and they really helped. It was very important for us to have the support in the adjustment of these strategies, so that we could really implement our activities and conduct our activities successfully. The strategy was to reach marginalized groups of young people, and the fourth strategy that was used was to include them. It was really a project that brought them solutions, because they were not even interested in going in those centers before the project. They were so sure to be stigmatized and that no one would hear them, would listen to them. And they felt excluded. So we really had to start with awareness, raising awareness, and tell them that there were services for them, independent beneficiary services that were available for them. So it was really a big work to start with of raising awareness among them, and then we could give them information and refer them to the right place, to the right specialist for young people. There was also this, so to do that, we distributed vouchers, and that was very important because before the project, the consultation sheet was something we had to pay. And for those young people who, for example, didn't have the means to afford it, or maybe they had difficulties because of an accident or something, then we could give them access, and that changed everything. Also, the strategic partnership was very important with the foundation, for example, because we had to evaluate, to assess periodically all the activities to know what was working and what was not. And the idea behind this assessment was really to make sure that these activities were relevant regularly and that everything that was planned was actually happening for real, as we had expected. The development of the sustainable plan was also a very important phase because we needed to make sure that the activities would not stop right after our work was over. And we needed to make sure that young people would become actors and that they would keep benefiting our services. Next slide, please. We talked about the three components at the beginning, and the first one was clinical component. Which activities did we conduct to achieve those results that were presented? Well, we trained staff on sexual and reproductive health for this project, for clinical providers and non-medical staff, like I said earlier. And for example, in the front desk, so that they could really greet all the patients. And we noted that in each phase, we recycled the staff so that we were making sure this way that they would really provide services that were relevant to the young people who were coming to the centers. And in each information session, we included the clarification of values and transformation of attitudes. And that was very important because we needed to make sure that our providers would greet participants and patients with no discrimination in a professional way. We also organize services for sexual and sexual health in such a way that we could really help all the young people who were even the marginalized one who needed help. And that was really important to stress that we wanted to greet everyone the same way. No discrimination, no stigmatization, and they needed to make sure that they were listened to with no bias. Regarding family planning services, we set up strategies that also made sure that marginalized groups of young people would be taken care of. It was very important that, for example, for these sexually transmitting infections, that they could be taken care of with no judgment and that they could access care. We have followed and adhered very strictly to the government protocols, and we made them available to the young people so that they would be aware of what we were organizing, how the activities were conducted, the services that they could benefit from. And also, we realized that it was very hard for people who were not aware of our services, it was very hard to reach them. So we really tried another thing as well, that was bringing them the services. So we made sure that contraception products and essential products for sexually transmitted infections would be affordable and available. We also made sure that we had a regular supervision for activities at the national level, and we distributed those we made sure that those services could be distributed and provided for. And also we have in this clinical component, as you know, if we don't supervise activities, we don't always know how things are going and if they are actually taking place. So in the health zones, in the health formations, we set up a pyramid of 3 levels, where at the 3 levels of the pyramid where supervision was ensured. And this way we could monitor activities and all so it was very effective and very regular, and we made sure with data that the work was effectively implemented. Next slide, please. The second component, like I said, was community mobilization. And so this component consisted in creating a demand among young people so that they could ask for the services in those areas that we were working in. And so we trained peers, educators, and mentors in health zones and formations, including those who were coming from marginalized organizations. We trained them in the sexual and reproductive health themes, of course, and also on communication, for communication techniques, because with young people, you have to make sure that you can communicate properly to ensure leadership and advocacy, so that you can really answer their needs. And of course, in the training, we also included leadership, advocacy, and CVTA. Regarding accountability, we also made sure that the young people could actually become actors of their own health, and that they could take the lead over the situation, so that we had to mobilize resources in the way that young clubs for young people already existed. And that was a very important resource that we used, because that allowed us to target young people, and it allowed them to have a forum, a kind of a safe space where they could share and get advice about their situation. That was very useful, because we realized that they really needed to talk and to be heard about it, and they were provided with information about sexual and reproductive health, and we realized that it was very relevant when they had sexual issues, for example. For each quarter, we were organizing information sessions for upgrading, because we really wanted to make sure that the capacities were that the people were the pairs were really trained, and that they could receive relevant information about the themes that the community activities were focusing on. That's an example. For example, on Excel, the reporting on violence or sexual violence, or that's something that they were working. That we really need to make sure that the information were relevant.
We implemented a digital platform which we added a lot of information accessible to the young, to the youth, and where they could post and share their own activities, and also between different organizations. It was a great framework for all these youth to have access to all this information, a good way to express themselves, but also to share their feelings and their information. We also organized a good amount of campaigns in schools, in churches, to provide information. So, for example, for youth that never had this type of information, or the youth that couldn't access or couldn't go to the youth corner. As we also created a consultative youth council led by non-profit leaders, and so they could get together, plan actions, share information. We supported, we also provided legal support, especially those who are survivors of gender-based violence. And this is an aspect which was strongly admired by many people, because very often these cases of gender-based violence go nowhere, they not get resolved. We also provided in youth corners and other organizations some vouchers which would provide marginalized youth to have access to care in those youth corners. Now, when it comes to sign language, we train providers. It was a great activity, because very often marginalized youth are mute or hard of hearing. They had a hard time. They used to have a hard time accessing those cares because they needed to be accompanied by somebody. So we made sure to integrate sign language so that they could exchange with the providers. So we targeted our service providers that now offer services to the mute and hard of hearing, and that's an unbelievable innovation for our project. We organize sessions of mentoring to make sure that youth can work on their own activities. And that was work done in partnership with AYSRHR. Each quarter, we organize evaluation and validation data sessions with service providers. And so that was the opportunity to go over the collected data on the quarterly basis, added into a document. And so we organized sessions to validate these data, and those data were added into our system and then shared with Pathfinder. Next slide. So let's talk about advocacy now. We worked on several activities to strengthen our efforts. So for example, with local organization, with CAFCO, l'ISADIL, SGD, for undesirable pregnancies. And thanks to these type of partnership with local organization, we were able to help the publication of the Maputo Protocol, which is a protocol that was accepted at the country level, but it was hard to implement it at the regional level with the civil society. So therefore, it was published in the official journal, which also enabled secured abortion services. So 3 pillars: access to contraception, and thanks to this new law, we integrated this access to contraception methods by the youth. Next slide. So what are the main challenges here? The main challenges we experience can be summed up as social cultural barriers, obstacles. Everything related to sex, abortion are taboo subjects in society. We do not have a unanimous approach to this. We all don't think the same way, especially when it comes to abortion. We must continue our efforts so that society becomes more open and guarantee the sexual and reproductive youth of our young people. Stigmatization is also a big obstacle. The use of contraception is more or less accepted because we know that family planning is somewhat accepted in society. We also faced serious lack of resources. The needs are huge to meet the young people needs in all categories. So our resources were unfortunately limited. We did whatever we could with what we have, but the needs are huge to satisfy those needs. Now, as a conclusion, in spite of obstacles, those social cultural barriers, stigmatization and lack of resources, the flexibility of financing, and so thanks. We thank the Packard Foundation because their financing approach was very flexible, and the commitment of our partners at the government, local levels, those allowed us to adapt our strategy so that we can implement our project with the great results that we just showed you. The implementation of the project also showed that the community approach, the community and inclusive approach is key to meet all the specific needs when it comes to the sustainability of this project. As soon as the youth own this project or have a voice in those projects, they start advocating for it and they share the information. We also want to commend the role of EF, which played a crucial role in our community and in our activities. They were our pillars. They were on the ground. Thanks to them, we were able to organize all the updates, information sessions, the education of peers, the training sessions. We also relied on them for the distribution of our products and our services. So we commend their work, the work that they did and that they continue to do on the ground. And we really wish that this organization can continue the work and support the youth in their environment. So this is what we can say when it comes to the implementation of activities of our project, what we did, our strategies, our activities, and the results that we managed to show you today. And now I'm going to give the floor to our moderator, Beatrice, for the rest of our program. Thank you so much. Thank you so much, Madame Albertine Mavinda. I think this was a great way to show the different steps, the pathway of our program. We are now going to move to the next phase of our presentation, which will be just about as interesting. Now, we are going to give a voice to our young people and give the floor to Miss Edith Matondo, who's a member of the council and in charge of research and advocacy for Texas. She's going to talk about what it looks like to be young in this concept, community leadership, and the impact of the project on the young people that are marginalized. Edith, you have 5 minutes and the floor is yours.
Bonjour à tous.
Good morning, everybody. Good afternoon. My name is Edith Matondo.
Madame Béatrice.
S'il vous plaît, Edith, est-ce que tu peux mettre ta caméra, s'il te plaît?
And can you turn your camera on, Edith, please?
D'accord, est-ce que vous me voyez?
Can you see me?
Non, non, mais vous pouvez continuer.
You can continue. Go ahead.
Bon. Je suis Edith Matondo.
My name is Edith Matondo.
Je vais commencer d'abord par un témoignage. Je rapporte que la
So I'm going to talk about my testimonial. A young woman,
l'une d'entre elles m'a particulièrement dit,
and she told me
à mon 16e anniversaire,
on my 60th birthday, I went out with friends and I was raped. And I had a child and I didn't know the father. Had I known this information before, maybe I would not have kept this pregnancy. I would not have gone on with this pregnancy. Today, I would not face the same issue. I would know when to have a child and how to take care of my sexual life. This testimony shows the importance of our project for the youth, because today many youth are facing this issue. Here in Kinshasa, we have the internet and everything else, but very often this information is not reliable. And thanks to this project, the young people have true, reliable information in real time. With access to the Youth Corner, they can have access to services. And so this project has a visible and significant impact on the life of youth, and especially with the albino ones. Today, with all the work that's being done with Pathfinder, we realize that since 2019, we count way less women that we realized that this project had a great impact and had an impact on young women. So this project, which started in 2015, had an unbelievable impact because the information accessible to youth people, it's not always, because the information is not always accessible, but now everything is shared between themselves, so it has a true impact and visible to this population. The role of the youth is key here. You can't do anything without talking to the young people. Because also they're the first beneficiaries of this project, and they're the first one to carry and share this information. And the information also comes from those youth corners. Since these youth have attended the youth corner and benefited from this information, they became champions, they became ambassadors. So now they play a key role in our approach and in the way we can reach the goals of this project. Not only do they benefit from these services, I will say that when you create a project for this youth, don't consider them as just beneficiary. You need to give them a voice. They need to be able to make decisions. And when they are empowered with this type of information, they can share the information. I want to talk about advocacy now. The work we did with Pathfinder. So we did a lot of advocacy work, especially when it comes to access to information of youth, albino youth. I think all this information needs to be shared. Even the rate of pregnancy and abortion has gone down thanks to those youth corners. There's so many possibilities here. We wish this project to be implemented in different provinces. So there's a lot of different projects and a lot of different organizations in Kinshasa that makes this information available. But we lack some sort of information in different regions, in different provinces. So they have information, but maybe it's wrong information, it's misinformation. And we really want this project to be made available in different areas.
Oups, c'est comme s'il y a une coupure.
It looks like we were interrupted. So we're going to thank Edith for this vibrant testimony. I don't know if you were as moved as I was, but that was beautiful. Thank you so much, Edith. And now we're going to talk about the partnership, the strategic partnership. And I'm going to
Humblement,
invite very
Monsieur Mbadou,
humbly Mr. Madou,
fidèle directeur
who
du
is
Programme national de
the
santé
loyal
de
and
l'adolescent,
faithful
le PNSA,
director of the
ainsi que le
National
docteur
Program
Djibril Kene,
for
le médecin
Teenage
le
and
médecin et
Young
chef de
People's
division
Health.
chargé de la formation
He's
au
also
PNSA. Ils
a
vont nous parler de
doctor
l'intégration des
in
acquis
charge of
des projets
the
dans les
training
politiques
division, and he's
nationales.
going to talk
Nous
about
allons commencer
integration
avec
of
le
policies and
directeur
projects at
Mbadou.
the national
À
level.
vous la parole.
So we're going to talk to give the floor to
Merci
Mr.
beaucoup,
Badou.
Madame Béa.
Thank you very
pour la
much, Madame
parole.
Bea. Thank you for
Effectivement,
giving me
je
the
suis
floor.
Mbadou Mwanda
And
Fidèle,
indeed,
directeur du PNSA.
I am also
Le
working
PNSA, c'est un
with
des partenaires
Fidel, and
avec lequel ce projet a beaucoup travaillé.
we
Et
are
donc,
working with
je me sens beaucoup plus à l'aise de
Pensa,
témoigner.
who is a partner that
Et
is a
bien sûr
partner with
que
whom we've
c'est
been
avec
working
beaucoup de
very much,
soucis
and
parce qu'on aurait bien
I
voulu
feel
que ce projet
very
continue.
confident in talking about our
Je n'ai pas beaucoup de
collaboration,
minutes. C'est
but I
juste
don't
pour
have
dire
much
que le
time to
programme qui
talk
a
about the
travaillé
continuity of the
partenariat avec
project.
ce projet
I just wanted
avait
to
pour
say
mission, c'est
that
d'améliorer
the
la santé des
goal of
adolescents et
this
des
partnership
jeunes,
was to
d'intégrer les interventions spécifiques
improve
dans
the
le système
state,
de santé
the health
santé,
condition of young people
d'assurer la
with very
qualité,
specific
la qualité et
interventions to
l'accessibilité des services de
improve
santé des
the health
adolescents et des jeunes.
system and to improve the quality
Suivant.
of care for young people. Next slide, please.
Alors,
So,
par rapport à notre partenariat
regarding
PNSA
our
Pathfinder,
partnership
nos
with
réalisations, c'est
PENSA
que
and Pathfinder,
grâce à ce
what we
partenariat,
realized
on a eu un
regarding
cadre
our achievements,
de
I mean,
concertation entre
the
le
partnership,
DSSR
the
Ado et
partnership with
Jeunes
Pathfinder
qui a été fondamental.
in
On a, ce
for this
projet a
project
permis au
has been
programme de
fundamental
disposer des outils
because that allowed the
d'information et de
program to
communication.
have
Comme vous le savez,
tools for
l'information
communication
est
and
capitale pour
information,
l'adolescent et le
as you
jeune.
know,
Donc, tous
that
ces
were
outils
very important
d'ISC,
since
nous
it's
les
very
avons
important to
grâce à
communicate
l'appui
properly with young people, as
de
you know.
Pathfinder. Et
And
Pathfinder a accompagné
these
le
tools, we
programme à
got them
développer des normes
thanks to
cliniques pour les
Pathfinder.
prestataires. Vous
This
savez, les
is something
prestataires
that
sans
we
normes
could
cliniques, et parfois,
build
la
around
qualité n'est pas
the
bonne. Mais
development of
grâce à ces
clinical
normes
norms for
cliniques
providers.
qui ont été
And thanks
vulgarisées et qui
to
sont utilisées,
these clinical
nous sommes sûrs de
standards
l'assurance
that we could
qualité
develop, then we
lorsque les
could make
soins sont
sure
offerts aux adolescents et aux
that we
jeunes.
had
Alors,
quality assurance
on a créé
services
le coin des jeunes, qui sont en
to
fait des aspects, des espaces
verify that the
conviviaux
quality of
qui
care for
réduisent
young
la
people
stigmatisation.
was
Et on a mené beaucoup de recherches
aiming at
opérationnelles
reducing
pour évaluer et
stigmatization.
améliorer l'efficacité du modèle.
And
Alors,
also, we
ce
wanted
que
to
le PNSA a
improve
beaucoup
efficacy
aimé,
of the model.
c'est que les activités qui étaient mises
What
en
we
œuvre
really
par
liked
Pathfinder
in this
étaient
partnership is
accompagnées
that the
de volets
activities
recherche.
that were
Donc,
implemented
les
by
évidences nous
Pathfinder
aidaient à améliorer
was
l'offre de
backed up
services. Et ça,
by
nous avons beaucoup aimé.
data,
On a organisé
evidence,
beaucoup de recherches avec
and
Pathfinder,
that really allowed us
de
to
sorte que, à part
have a better
l'unification
estimate
actuelle,
and better understanding
c'est
of the
Pathfinder
services that
qui a
we needed
beaucoup
to
travaillé avec
provide. And
nous
Pathfinder
en
really
croyant
worked
à la
with
recherche,
us
en générant des évidences.
and they
C'était
believed
notre
in what we were
gain.
doing. That research aspect was very important for us.
Le dia qui suit, alors,
So
parmi les
for the next
résultats
slide here,
clés,
among the results,
c'est
the key
l'amélioration
results and the impact,
significative de
that was
connaissances et de
the
pratiques des
significant
adolescents et des
improvement
jeunes,
of
surtout les jeunes
awareness
qui
and
fréquentaient le coin des jeunes.
about
Alors, dans le coin
sexual and
des jeunes,
reproductive health
qui ont
practices among
été
young people
implémentés dans le cadre de
who
ce
were coming
projet,
to these
quand vous y
forums
allez,
and
il y
had
a un accueil
the
convivial, il
the
y a la
safe space that we
confidentialité
created
et surtout
for
la gratuité des
confidentiality,
services, parce
privacy.
qu'avec le
They had a
coupon,
warm welcome and the
tout
services
ça
were
a permis
free.
aux jeunes
They
vraiment de
also could
fréquenter le coin
access
des
to
jeunes.
these vouchers
Et on
that
a
were
remarqué, parce que nous allons souvent en
mentioned before.
supervision, une
And
réduction des
also,
obstacles
because we had
psychosociaux
supervision, we
et de la
realized that it
stigmatisation
allowed us to reduce
grâce
the
au coin des
obstacle, the
jeunes mis en
barriers,
place par le projet.
psychosocial barriers,
Suivant.
and stigmatization. Next slide, please.
Alors, comme approche innovante, parce
Now,
qu'il y en avait
regarding
beaucoup,
the
c'est
innovating
que
approaches,
on a
and there were
testé
a
une
lot,
approche de réduction
is
des
that we
méfaits liés aux
tested
avortements non
an
sécurisés.
approach related to
On a
abortion that were
établi
not safe.
des standards cliniques
in order to reduce the secondary effects of these abortions. And what we did was to have a standard in order to improve the situation, because of course this is a sensitive issue, but it is less and less. And when the project started, people would say, what's going to happen? And so that's why we had backed up in advance that project with research. And because of this research, we could get standards that really helped for this project. And these were the first standards. So now, to conclude, and so conclusion and next steps, the PNSA is actually committed to integrating what we managed to acquire, to the results, the outcome of this project, to reinforce the capacities of providers and improve the offer of services in sexual and reproductive health. And these tools are now used when we are strengthening the capacities of each provider. And that's really important. So when the project is over, we mobilize the resources that were necessary, and we can sustain the dynamic and sustain the efforts and the impact. And the idea was really to give more means for that project to be sustainable. Mademoiselle Maton also earlier said something similar, that it was a project for 10 years, that it was 10 years continuous in a row. And that was very, very useful, because we have trained providers, we have peer educators now, and all the material, the equipment that is relevant, with which we can now keep going on those services for young people. And we keep reminding everyone that this project has been very useful in health formations and everywhere, with agents also, workers, everyone we're going to meet, or any provider that is going to take part in this, will be trained and will be aware of these great achievements that we got thanks to this project. And we're very sad in a way that this partnership is over, because I would really like this project to keep going. But thank you very much for everything. Thank you, Pathfinder. And thank you to all the partners who work with us on this collective, collaborative work, and the entire team. Madame Beatrice, Madame Moringa, and everyone else who worked very hard to make this project efficient. And they were good persons at in the right moment, and they had good work with us. So I thank you very much. I'm very grateful. Thank you so much. Thank you, Director Mbadu, and the pleasure is all ours. We're very happy to work with you too. Now I'm going to give the floor to Didier Lukeme. Thank you.
Merci beaucoup, Maman Béatrice.
Thank you so much. Thank you, Madame Béatrice.
Je suis Dr. Didier Lukeme.
I received.
Je suis chef de division chargé de
my name is Didier, so like my predecessor. And I am in charge of divisions and the training program at the national level, like was said before. And I would like to share today my experience with everything we had, with everything we went through, and the support we got within this project. We were very lucky to get the support, and we benefited from it for years in several fields, whether it was for strengthening of skills for providers or community, and also the development of some material. And 10 years after the beginning of that project, we can say that we achieved a lot of things. Lots of activities have been conducted and have been very effective. And you can imagine within 10 years, everything we could do, right? But this is not something that will stop, of course, after the end of the project. We truly wish that everything will be sustainable. And this project allowed us to really make sure it was sustainable, not unlike many projects that were not. And now we realized that it was very interesting and relevant to capitalize on what was achieved. That's very important. Those spaces, the safe spaces that that was called Coin des Jeunes in French, like the young corners. That was very useful because we allowed the young people to have a forum where they could interact and share their experience and their situation. And the stakeholders must be thanked because that was very important. We created 6 of those corners, and we could train the service providers. That was really something that was supported here in Kinshasa, and that was a strategy that was more and more developed for now, implemented. And this there is a lot of evidence that show that it was a very crucial step for to ensure the continuity of the services offered by these corners. So we also got the participation of the government, and also there were lots of stakeholders involved in the implementation of the program, thanks to whom we could develop an implementation, a sustainable plan to make sure that we would keep going with the activities that were implemented after the end of the project. And in a way, I could say that the project is not ending because it is still ongoing, and there are still lots of activities and, like I said, many achievements that we reached, that we accomplished. They are still ongoing, and we are not giving up on the practices. They are now well implemented for long, for good. And the plan that we set up for sustainability describes very clearly principal activities that we want to sustain and the strategies of implementation, and for coordination also at the national level. There were So the most important thing was really to coordinate all the interventions for the organization, but also for stakeholders who have been involved in the implementation of the plan at different levels of the pyramid. Also for the national program for teenagers, a mobilization of resources, additional resources. So that were the mechanisms that we chose. So the technical meeting of experience sharing, and also meetings for assessing, for monitoring, and to produce reports on all the report on these activities on the sustainable plan. So now we are working on the ownership of the sustainable plan by the stakeholders, in particular by the government, and make sure that it's really integrated in the national strategy, and also for these peer educators that we talked about in the community animation cells or units. The local organizations that are supported by the project are now members of the coordination platform for sexual and reproductive health. So we realized it's very important to do monitoring and follow-up. So how we're going to do? We're going to implement technical meetings on experience sharing, like we said before, with participants, and there will be also monitoring and follow-up meetings for stakeholders and about interventions. And then we have coordination meetings. So how it's going to work? Well, we have to make sure we follow up on the activities and they will keep going in this same direction. Regarding this initiative of setting up the sustainability plan, like we said, this is the end of the project, but I recommend to the other partners that are currently implementing similar projects that they should reflect on which mechanisms to implement so that when their project also reaches the end, that their activities will be still ongoing. And the idea is really to make beneficiaries accountable and actors. So that's what I wanted to share as my experience to Pathfinder regarding the sustainability plan. Thank you very much.
Merci beaucoup.
Thank you so much.
Dr. Lukeme. Merci.
Thank you, Dr. Nkeme.
Nous allons maintenant
Thank you so much.
continuer
Now we're going to keep going
des partenaires.
and talk about the commitment and engagement of partners. Now I will give the floor to Vicky Mbutu, who is the Provincial Coordinator of the National Program for Health and Reproduction, and also of the Santa Malaika, Mr. Brady Bilala, who is the Director of YAP, and they're going to talk about advocacy and legal improvement in sexual and reproductive health and rights. Thank you very much, Vicky. I'll give you the floor. Thank you so much, Madame Beatrice. Hello, everyone. My name is Vicky Mbutu. I am a coordinator doctor for the National Program on Sexual and Reproductive Health in Kinshasa. It is a great honor for me to take the floor today and recognize the important work that was accomplished within this project and that was necessary to improve the situation, and in particular for those young people. And I want to talk about the advocacy work that was really important and very transformative. To introduce this presentation, I would like to talk about the partner of the project that was there from the beginning. We have worked very closely with Madame Beatrice and together we've shared our vision, the same vision, and that changed everything. We wanted equitable access to sexual and reproductive health and services and rights, even the most marginalized groups, and with no judgment and no discrimination.
Slide, please. And one of the most significant results of this partnership is the publication of the Maputo Protocol in the official journal of the DRC. That's a great result, given all the products that we know with and the high level of clandestine abortions. So this long-awaited protocol now authorizes abortion in very clear, defined cases. So in case of rape, incest, or in danger to the physical or mental health of the woman. And of course, this is not just a legal text, but a historic step forward, a strong signal sent to all women and girls in our country. It's their right, their health that matters, and the voice that matters. So this has not happened by chance. It is the result of a long-term effort carried out by different committed partners in sexual and health, reproductive health, such as the CAFCO, LifePath, and of course Pathfinder, who helped us to get all these results. So together, we organized activities such as conference debates with youth, workshops to clarify values, as the different participants said, meetings with policymakers, and above all, we did this by listening to the young people. The advocacy carried out by the young people themselves trained and supported this project and was a powerful lever to change attitudes and policies in our country. As PNSR, we also benefited from the project's technical and financial expertise to develop the first national clinical standards for comprehensive abortion care. And it helped providers to do quality work. So these standards are now a reference for health providers and ensure that the services offered are being safe, respectful, and adapted to the needs of the young people. So thanks to these two results, we've gotten great strides in our country. So I would really want to thank our partners. And as a conclusion, I would like to express my gratitude to Pathfinder through the DSSR Ado-Youth project for its unwavering commitment. Of course, the progress that's been made is remarkable, but there's still much to be done. The PNSR remains committed to sustaining these achievements, strengthening the capacities of providers, and extending these good practices at the national level. Once again, thank you to all of you for your attention, and thank you for your commitment to sexual and reproductive health rights in our country, and especially in the province of Kinshasa. And thank you so much. Thank you so much, Dr. Vicky. We're now going to give the floor at Toms Ipupola. Toms, you have the floor. He's a medical director at the Health Center Malaika. Dr. Toms, you have the floor. Thank you so much. Good afternoon, good morning, everyone. Dr. Toms Ipupola, a medical and legal perspective on comprehensive abortion care. Our goal today is to share the approach adopted by the DSSR Ado projected with regards to comprehensive abortion care in a legal, complex, and societal context. So as a healthcare professional, we have encountered many situations where young women came to us, our facility, after attempting to terminate pregnancy in dangerous conditions. This is the direct result of restrictive laws, but also lack of information, dialogue, and appropriate services. So we had to come up with different approach, a more pragmatic and humane response to a reality that can no longer ignore. Next slide.
Alors, comme constat, nous avons donc constaté que
we realized that
plusieurs jeunes ont fait recours au misoprostol dans des conditions encadrées. La quasi-absence des complications graves.
Absence of serious complications, because we feared that the complications would be some sort of a barrier.
Qui essaye de le mettre dos au mur, notamment les situations juridiques telles que nous avions.
So, because we very often encountered legal issues.
Nous avions donc compris qu'il y avait aussi
so we also realized
des méthodes contraceptives modernes, un accès
that
de soins aux jeunes de qualité.
An access.
Nous avons donc, par rapport à tout cela, nous avons donc compris que
we have understood,
avec cette politique,
thanks that because of these policies, youth could have access to secure, to safe services, but it was only for the youth that had money. Here, we want to give global approach to everyone. Safe abortion care, which used to be only accessible to people with means, with a minimal amount of training.
Tout le monde est pratiquement dans un plan de sécurité sanitaire égal. Bien suivant.
Next slide, please.
En conclusion,
as a conclusion,
la santé des adolescents et des
the health of teenagers and youth is a source of concern. For anybody who hasn't experienced our conditions, it would be hard to understand what's happening. But when we read the conclusions in terms of sexual and reproductive health, we understand that it's a major concern. Hence, the need to implement some of the approaches, such as the approaches implemented by Pathfinder, who's trying to be more flexible and to try to create some equality when it comes to right to access these services. So it was about implementing some milestones, understanding the barriers so that the access would be acceptable to all of us, to everybody. So hence our thanks to Pathfinder. Next slide.
Est-ce que c'est bon, Dr. Thoms?
So you're done, Mr. Thoms? You have a few more minutes if you would like to continue.
D'accord.
No, thank you so much.
Donc, nous dirons que cette approche
So
est une forme d'ouverture.
So this approach is a sort of opening, since Pathfinder dared to swim upstream and go against the current. All partners follow suit. So Pathfinder was a literal pathfinder, and they managed to trigger a new approach, open the way, and offer quality care for these young people. We wish this approach could continue. Unfortunately, we're in a situation where Pathfinder needs to withdraw from this project, even though there's a sustainability plan into place. But we have to recognize that the approach was extremely efficient thanks to Pathfinder. There's serious problem in our country when it comes to sexual and reproductive health. So this project would be a way for marginalized children or youth that lack information can find some information in those youth corners, and so that they can access care and information while being respected. Thank you so much. Thank you so much, Dr. Thoms. Thank you for your testimony. Now we're going to move on to Brady Bilala. You have the floor. He is...
Je suis Maître Brady Bilala.
I'm Brady Bilala, director of the NGO IYAFP, the International Youth Alliance for Family Planning, which works mostly on the promotion and the defense of rights of young people and women in SHR, in the
mais aussi dans tout ce qui concerne la paix, démocratie.
So our areas of interventions are health, governance, leadership, entrepreneurship, education, peace, and democracy. We're a national organization.
Comme je l'ai dit, notamment dans le domaine de la gouvernance.
So we work on governance and leadership, where we bring all our support to the young people.
toucher ou traiter les questions de paix et démocratie.
So that they can talk about peace and democracy, but we also work on entrepreneurship. Next slide, please.
Alors, il nous a été demandé de pouvoir aborder la thématique
So we were asked to talk about mentoring young champions
le mentorat de jeunes champions comme un des piliers
as
du projet droits
one
sexuels
of the real pillars of our project.
Le mentorat comme l'un des piliers de ces projets
So as a pillar,
était essentiel pour pouvoir
it was crucial
les jeunes activement
because we could actively involve young people
dans l'optique de pouvoir leur
in the sense that they would own the project,
pouvoir siéger aux différentes instances de prise de
so that they would not just beneficiaries, but they would be agents of change. When they're not involved, these young people, especially in the topics that they're involved in, it's hard to find solutions adapted to them. And this is why through this project, that young people are not just beneficiaries, they're agents of change. So the goal of this mentorship program was to create a new generation of young leaders capable of defend their rights, speaking out on their behalf, especially in sexual and reproductive health. Next slide. So through these projects, thanks to the other stakeholders, the government, the different programs, the reproduction programs, but also other organizations, we were able to accomplish a certain number of activities, such as the training of young champions on leadership, advocacy, communication, efficient communications, the creation of club and associations in 3 health zones, so Massina 1, Matete, Ngiri, but also the inclusion of marginalized young people, deaf, hard of hearing, albino, and disabled youth. Next slide, please. All these actions, thanks to the help of our partners, of the PNSA, but all those stakeholders involved in this project, the impact was concrete and direct at the country level. So together, we were able to organize awareness campaigns in school, in churches, in public spaces, with the goal to enable young people and women to have access to right information, access to services, being able to be redirected in the right health centers, especially when it comes to contraception, family planning, etc. We also organize community discussions to break taboos, which are, as we know, are one of the biggest barriers to accessing these type of cares, and also access to information and services available to healthcare, sexual and health services. We also met with decision makers to influence policies. So high-level meetings with everybody to target the key decision makers, talk to them about SRH with youth, and to understand how these decision makers who really have the power, how they can influence local policies and improve the life of our young people.
For example, for the communication of the protocol, Maputo protocol, and also the standardized development of directives, and also the publication of the law about contraception offer for young people and women that are the results of this encounter that allowed us to participate with organization of young people within this project. We also contributed to research actions at the level of the national program, and as a community organization, we could contribute to the reduction of barriers. Next slide, please. So, we believe that this is very important. So, mentoring of young people that created a committed generation. Young people have been increasingly involved in these issues of sexual and reproductive health. And that really matters to us because we feel that it's a really new generation that is more involved, engaged, and so they really become actors of their own situation. And that's a very, a much better, it's a response that takes into account the need that needs to be answered. And that's something we need to maintain, like as it was said before. So that's a strategy of mentoring those young champions, like I said earlier, because it's a very important measure to make this these achievements sustainable in the long term. And indeed, at the level of the different health formations, so health areas that really was favored by these peer educator forums, in which young people really have their word to say in the activities at the community level. And also, it's very important for leadership about health reproductive health. So that's what I wanted to say as a conclusion. Thank you so much. And what we can say now regarding the mentoring of young champions in this project is also we take advantage of this situation to thank deeply Pathfinder and all the partners who contributed to these amazing results, because this project really allowed us to become a sustainable organization and well considered by the other international organizations. And now we are working very efficiently thanks to the help we benefited from Pathfinder. Thank you so much. Thank you. Thank you so much from all my heart.
Alors, nous allons terminer.
So,
Voilà,
we're
nous
going
allons
to
rapidement
conclude.
clôturer.
very soon.
la parole à Dr. Marie-Claude
So now I would like to give the floor to Dr. Marie-Claude so that she can wrap up. Thank you very much.
OK.
Okay.
Le mot de la
So
fin, on voudrait
to
clôturer. C'est vraiment
conclude,
un grand merci.
we really wanted to
Un
thank
grand
everyone.
merci à chacun et chacune de vous pour votre
Many
participation.
thanks to
Un grand
each of you for
merci
participating.
aux,
A very big thank
aux
you for
intervenants par leur
all the
brillante
presenters
présentation qui nous
for
a
their
fait
presentation
faire
that was
le
brilliant and
parcours.
very
Nous
interesting,
sommes rentrés
and
sur les
thanks to
10
which we
années
could
de
really
mise en
follow
œuvre
up
du
on the
projet.
path that
Et nous avons
allowed this
vu,
project to
nous
be
avons
implemented
suivi
little by little at every
cette
step.
expérience
That
intéressante
was
à
really
travers les
incredibly
différents
interesting
accomplissements,
to
les
share that
différents
experience
témoignages.
in
Et grand
these
merci à
accomplishments,
tous les
in these
partenaires,
achievements. And I really want to thank all the
aux
partners,
pairs éducateurs, aux
to the
jeunes de
pair,
toutes
many thanks to the pair and
les
educators,
catégories,
all
aux
categories
prestataires
of
de soins qui
organizations,
se
all
sont investis
providers
pour rendre leur service
that who really
inclusif, notamment pour
engaged to
les
make sure that their
sourds-muets.
services
Et
become
merci
inclusive,
beaucoup.
including for deaf and mute
Donc,
people.
le projet
Thank you
Packard
very
nous
much
laisse
for
un
everyone.
héritage
So
précieux
that project really
que nous
leaves
devons
behind it
préserver
a
et
legacy that is
pérenniser.
very precious to
Donc,
our hearts,
l'appel,
and we really want to make
le
sure
mot de
that
la
it
fin,
it
c'est un
stays
appel.
sustainable.
Un
So
appel
to
à
conclude, I really
continuer
want to
le
say,
plaidoyer,
please keep going. Please keep
à
going with the
soutenir
advocacy.
cette approche des moins et des
Please keep
jeunes qui a
going
montré ses
with
preuves.
the
Les études, les
sustainability
évaluations qui ont
of
été
this
menées
project.
ont
And
montré
these
des
corners
résultats
of young
très
people,
encourageants. Donc,
these
et
safe
un appel
spaces
à
that were
continuer
really
à travailler
promising.
ensemble
That's very
pour
encouraging, and
garantir
let's keep working together
les droits
to make
en
sure
santé sexuelle et
that all the
reproductive des
rights
jeunes et
in
des
sexual and
adolescents
reproductive health of
partout
young
dans le
people
pays, partout en
can be
Afrique et partout dans
respected
le
everywhere in
monde.
the country, everywhere
Merci beaucoup.
in Africa, and everywhere in the world.
Et
Thank you very
nous
much for
clôturons par
everyone,
là
to
notre
everyone. And this is
webinaire.
how I
Je
would
remets
like
la
to
parole à
conclude this
Béatrice.
webinar. I would like to give the floor to
beaucoup,
Beatrice
Dr.
now.
Marie-Claude. Je
Thank
vais
you
pas
so much,
répéter
Dr.
ce que Dr.
Marie-Claude. I'm not
Marie-Claude a
going to
dit, mais
repeat again what you just said,
à tout
but
le monde, surtout à
really,
tous ceux
these
qui ont pris le temps de
it
nous
goes
écouter.
straight to my
Et
heart, and I want
vraiment,
to say
merci
exactly the
d'avoir
same.
voyagé avec nous.
Many
Nous
thanks to
avons
everyone.
tous les
Thanks
documents,
for
tous les outils nécessaires
traveling
à
with
votre
us on this
disposition. N'hésitez pas
path, and
à contacter
we have all the
Packard
documents,
si
all
vous
the
voulez avoir
tools that are
accès aux
necessary that we
rapports, à
can
tout
make
ce que
available to you.
nous
So
avons
please do
accompli
not
pendant ces 10
hesitate.
années.
We can give you
Mon
access
grand
to the report.
remerciement
Many
l'équipe
thanks
Pathfinder
to
et à la
the
Fondation
Pathfinder
Packard
team
et surtout
and to the
à
Foundation
Maman
Packard
Betty, mon
and the Packard
assistante.
Foundation, and for my assistant. Thank you so much.
Merci. Merci à tous.
Thank you, everyone. Thanks.